Hi everyone, you're welcome to Agewell Healthcare Talk series by your girl Olayinka Raymond. Today we're going to be talking about how to diagnose and treat mild cognitive impairment in older people. There are changes to memory that can occur in older people, and this can be very disturbing, can be very frustrating, especially not being able to put a name to a face. It can make you wonder if what is yet to come. Sometimes it can lead you to start wondering what brain foods or exercise to try. And so, but before you do this, you need to understand what it might or might not be. If your older person started acting very funny, it's not necessarily a mental health disorder. It could be mild cognitive impairment. So stay tuned, and I'm going to share with you how you can diagnose and how you can treat mild cognitive impairment. Somebody asked me this question, like, is it common for older adults to feel they are having trouble with certain memory or thinking tasks as they get older? So what I can say is that, whether it's mild cognitive impairment, in this particular case, but it can also be something different, something more. So it's important that we do the proper check to observe and then, diagnose it appropriately so that it can be treated. Let me start by first of all defining what mild cognitive impairment is. So, mild cognitive impairment means having cognitive abilities. That means you have memory and thinking skills that have become worse than normal for your age. Now, this is not just related to older people. However, the memory of or other problems shouldn't be so bad that you can no longer complete daily tasks that you need to do, such as finances, meal preparation without assistance. So, in other words, these impairments can't be bad enough to meet the criteria for dementia. So, we're going to talk about dementia another day. So, mild cognitive impairment is basically when there is a decline in your cognition. That means memory and the thinking skill. And just to say that mild cognitive impairment can be treated. So, because an older person is losing their memory or ability to think, that doesn't mean that you just assume that, well, it's old age. It can be treated, it can be improved upon. So, instead of you just, thinking that that is it, you might need to get it assessed by a clinician. So this is how you can find out if difficulties fall within a range of normal age-related changes versus being worse than normal. So which is, what we say the criteria for mild cognitive impairment. So how is mild cognitive impairment diagnosed? So in short, MCI is diagnosed through clinical assessment done by a qualified doctor or other healthcare professional. So a clinical assessment usually done that includes number one, they could interview the patient regarding his concerns and inquiry about difficulties managing life tasks like activities of daily living, asking how they are doing. We can also assess whether family members and other observers have noticed anything concerning or evaluating cognitive abilities using short office-based tests, Monterey cognitive assessment. So this will be done, by the clinician. As part of the assessment, we also check their prescribed medications and also over-the-counter medications that the older person might be taking to see if they are known to make thinking worse. Apart from that, we're evaluating for medical conditions, including mental health conditions and sleep disorders, which can worsen thinking or can mimic early dementia, will also be assessed. Some laboratory works is usually often done, like checking the thyroid, uh, vitamin B12 deficiency, some electrolyte imbalance, all this to be checked as well. So after all this assessment has been done by the clinician or the healthcare professional, the person might be referred for further tests. So, but that's not the basis of this discussion. But like I said, you don't just assume that because an older person is forgetting some things or having difficulties, with their thinking or memory, that means, oh, it's older person, that's they are old. And so what I want to emphasize for this section is that you need to properly diagnose anything that has to do with mild cognitive impairment or memory issues or thinking problems, cognition in older person. And the earlier it is identified, the better it can be, improved upon. It could be maybe a medication that we're reacting to, or it could be any other thing. So that needs to be assessed appropriately. So do not assume that memory loss is just old age and then you leave it like that. They can be improved on and they can be treated. The next episode, I'm going to be talking about the treatment of mild cognitive